Hi, my name is Kim Rigger, and I've been a nurse for 35 years. The last 20 of those have been in the leadership position, and currently I'm enrolled as a MSN student at National American University. Today's assignment was to talk to you about HIPAA and the privacy laws. So the first thing is you need to understand what HIPAA stands for. It's Health Insurance Portability and Accountability Act. It started back in 1996. It is a federal government law, and the legislation provides for data privacy, security, and provisions for safeguarding the medical information. And that's what's really important. So we have to be able to get the information to the right people and protect it safely. And as well, the patient themselves has rules and laws that govern their ability for control of that information. They own that information. It's their, that's their personal health information. So privacy laws came into effect in 2003, and on the Health and Human Services.gov website, that's hhs.gov, I found a lot of great information that will be included in this presentation. And one of the documents is called, What Does the HIPAA Privacy Rule Do? And I think it really summarizes and explains it succinctly for you. It's written, required by April 14th of 2003, and the HIPAA privacy rules creates national standards to protect individual medical records and other personal health information. It gives the patients more control over their health information. It set boundaries for the release of the information. Not everybody gets everything, so as the patient, you have some rights as far as that goes. And then safeguards that, ensures that the organizations that are warehousing that information are protecting it and keeping it secure. And then it holds violators accountable should they fail to safely protect your information. Now, whether that is from a cyber security attack, whether it is just blatantly leaving information out or speaking inappropriately about patients and their conditions in a public format, there's lots of different ways that you can share your protected information, and HIPAA covers all of those different guidelines. There are also rules for how organizations and individuals can manage their information and keep it safeguarded. And so when choosing an EHR or an electronic health record, it's very important that there are safety measures built into it that will provide for HIPAA and privacy laws and rules. For a patient, it means you can make informed choices about seeking care and reimbursements for the care that you're going to receive or have received. And you have ability to limit and release information to those that you choose. There is going to be some format of that where public health safety also comes into play, and there is some data collection that comes through that's mandated, but it's all protected under very strict guidelines. And so should there be like an Ebola outbreak, that information is going to be released for public health reasons. Should there be a gunshot wound that comes into the ER or child abuse case, we're mandated to report that. Part of that federal law is that there are some very specific things that need to be reported. It also gives you as the patient the right to examine your chart and obtain a copy of it, which is something that seems like it should just be obvious, but apparently, it's not always as obvious, and they stated it very, very clearly in these guidelines. I also wanted to say that privacy rules, they were very specific for preventing or controlling disease, injury, or disability. That's the public health portion of it. There's the vital statistics, the births and deaths as well, as surveillance, health surveillance, investigations. Like in the ER, an STD case, we have to report that, just like we would the gunshot wound or the child abuse. Those cases need to be followed to track the sources to make sure everybody's properly treated. In the case of Ebola or humongous flu outbreak or like the measles outbreak going on now, there is information that had to be released by the hospital for the health and safety of the public. Another option on the Health and Human Services website, it's called healthit.gov, and they have several different links that I found very informational, which would help you as the learner or the student understand what it is HIPAA and privacy are and how that pertains to you. So the one thing is the operation. How does HIPAA work and how does the release of information go? That's one of the documents. And the other one is, what are the rules and regs that go for the exchange of information regarding treatments? So what I think of there is like you as the patient in the center of this big cog, or you can think of it like a daisy, a feather. It's got all the different little branches that go around it. And it could be your PCP, it could be your endocrinologist, your rheumatologist, your cardiologist, it could be the dietitian, the exercise consultant. All those people have access to your information based on continuing your care, which is some of that is implied consent, and you sign that when you agree to treatment through a provider. But it also says if I need specialty care, everybody in the continuum knows my health history and has the exact same information, so they can be making informed decisions based on your past history, and also go from there as far as making sure that information is transferred back to the right people after the treatment has been received. Again, as the patient, you have access to that, and it's your right to obtain that. You have to do it, of course, the right way, especially if you, as the healthcare provider, is the patient or it's your family member. You cannot go access that information yourself. You have to go through the medical records department and get it through the proper channels, so it's released properly and identity is secured and validated and verified that it's not being used for the wrong reasons. So that is HIPAA and the privacy. There are violations, of course, anytime that you do break those, and they are multi-million dollars if you're found at fault for failing to do a risk assessment of your health information services and your systems. But when you think about it, you also need to include the mobile devices that you might not think of right on your physical property, like pacemakers. They are connected through the internet or through the telephone line to be interrogated, and that contains your PHI as well. Your identifiers are on there. So there, at any point along the way, that could get hijacked, so that system needs to be very secure. There are the mobile monitoring for diabetics and the insulin pumps that can be reprogrammed, again, all remotely. So there's cybersecurity that's involved with those instances as well. The other thing I wanted to talk to you about is in 2009, there was another act that came out to continuously expand on this whole information, the electronic health information. It's called the Health Information Technology for Economic Clinical Health, or the HITECH Act, HITECH. And this one has to do with the financial incentives that go around having a medical record that is electronic, at least basic. So when they started back out in 2009, only 12% of individuals or organizations had a basic EHR. Within 5 years, that went up to 75%, and 40% of those were at the second stage of meaningful use, which involved using computer physician order entry, using the modules that check for interactions, drug interactions, and contraindications, height, weight-based dosing, transferring for your imaging and lab results downloaded directly into the medical record. So the more you move along into the stages of meaningful use, the more financial incentive there is for that. So we need to make sure we protect that as well and maintain that. Of course, if you breach that, and there's Stark laws or anti-kickback laws, so you have to realize that there are things built in to help protect the individual organizations and users to not have that information breached. But again, as I said, HIPAA is about your information and how it's shared, who gets access to it, whether it's by choice or not, and then it is very important for you to know your privacy regulations and what your rights and rules are as far as that goes. Again, I encourage you to go to the healthandhumanservices.gov. Healthit.gov is the best one that I found, and there's several resources there. Thank you so much, and I hope this helps explain HIPAA and the privacy laws.